memorize and apply this book. Guys, when a patient comes to you and they complain of a what? Of a dull and poorly localized pain associated with their tooth. Okay, that's a C nerve fiber that's being activated. Okay, a C nerve fiber usually gets activated near the end of the irreversible pulpitis stage, which means that this tooth has gone through the irreversible pulpitis and is near the end of the irreversible pulpitis and is going towards necrosis, pulpal necrosis. Okay? See? In most cases, it occurs later as a secondary pain. C fibers have a high threshold and can be activated by intense heating or cooling of the tooth. Alright? So patient complains of heat sensitivity. That means that the C fiber has already been activated, which means you're near the end of the irreversible pulpitis stage. This tooth is now going towards necrosis. And then you say, I had an argument with a general dentist, and she was saying that in cases like this, she just does occlusal adjustment, and the patient doesn't need a root canal. See, when you don't know the science, and you make stuff up, it's just really embarrassing. Know your science. So the reason you do occlusal adjustment, you take the tooth out of occlusion pretty much, and then patient gets relief. Do you know why that is? That's because this patient has already, as I said, gone through irreversible pulpitis. Is towards the pulp is going towards necrosis. There's also periapical changes. Inflammation has gone from the pulpal to periapical area. So there's inflammation of the periapical region. So this tooth is super occluded. So when you take it out of occlusion, you do occlusal adjustment. Of course, this patient the tooth is gonna feel better because by then the pulp has necrosed too. So that's why your patients feel better, because now you got a necrotic pulp. But that doesn't mean the occlusal adjustment worked. So patient leaves your office with an occlusal adjustment, and you think that your treatment worked. And later on, when the tooth blows up on this patient, it's very likely that they probably won't come to you. They go somewhere else for emergency treatment, because chances are that they don't trust you anymore. And then you think that your treatment worked, your occlusal adjustment worked. So this is called anecdotal science, or experiment, science, or no, not science, just anecdotal, and based on your personal experience. It's not rooted in science. So if you don't know your science, you're going to be in trouble, and your patients will be in trouble. Today's episode on reading from Pathways of the Pulp. If you do endo, or if you're a dentist, you need to know this book pretty much by heart. So I get a lot of messages from my followers. They're dentists. They send me a couple of x-rays and say, what do I do with this? Does this tooth need a root canal? They want me to look at a couple of x-rays and then tell them if the tooth needs a root canal. Doc, what is happening? Do your examination. Or if you're sending me x-rays, okay, x-rays are fine, but send me the rest. You need Tell me what's going on. Give me the medical history. Give me the results of the test that you've done. You need to have done examination and testing. Page 7 of Pathways. Extraoral examination. Intraoral examination. If there are sinus tracts, swellings needs to be noted. Sinus tracts needs to be traced. Palpation test. Percussion test. Tenderness noted upon percussion or percussing a tooth indicates some degree of inflammation in the periodontal ligament. Percussion test by itself doesn't mean a tooth needs a root canal. It's just a test that you do. Inflammation in the periodontal ligament may be caused by occlusion, trauma, sinusitis, periodontal disease, or extension of pulpal disease into the periodontal ligament. Percussion is not a test of pulp vitality. Thermal tests combined with electric pulp testing that evaluate pulpal nerve function are required to establish pulp vitality. Okay. Mobility. Test for the mobility of the tooth. Periodontal examination. What do I always tell you? You have to do periodontal examination of the tooth. What does that mean? You need to probe the tooth. Probe it. Then you do thermal pulp tests, which is usually cold test. Then the cold test will tell you the status of the pulp. I used to do heat test. I don't do it anymore. Electric pulp test, I used to do it. I don't do it anymore. But these are the things that you need to know. You need to know all of this stuff. Then you look at the multiple angulation radiographs, radiographic examination. And I talk about that, multiple angulation PAs. And then you need to, of course, be able to read x-rays and interpret x-rays. Radiographic interpretation. All right? So don't just send me a couple of x-rays and tell me, hey, doc, what do you think? Does this tooth need a root canal? Read this book.